Hello, everybody. I'm Dr. Chris Massetter with Ridgefield Chiropractic Wellness Center. Tonight I want to talk to you about something that I think is really important, a very important topic. And it's something that does kind of come up more often than you might think in chiropractic or in the office. And that's, whether or not, things like exercise, yoga, Pilates, even stretch lab, massage therapy, acupuncture, or even physical therapy. Do those things replace the need for chiropractic care? What about even things like foam rollers, chirp wheels, which I happen to really like, or even things like massage therapy devices and massage therapy guns, things like Theraguns. Do these things replace the need for chiropractic care? Far too often, comes up in the office where a patient will explain to me, well, I've been really exercising a lot. I'm doing my yoga routine. So I don't necessarily need chiropractic care anymore, maybe not as much as what I'm maybe recommending. And I'm not by any means, putting down these other therapies or not recommending them at all, because actually they are all really great. And if anything, they complement chiropractic care really, really well. And if you do these activities, maybe you do need to see the chiropractor, or maybe you can see the chiropractor a little bit less. And maybe the results we do in the office might be a little bit better because of improved flexibility or stability or reducing the amount of stress in your life. So those are all great things, but they absolutely do not replace the need for chiropractic care. So why do you think that is? Okay, well, the goal of chiropractic care is very, very specific. It's correcting the vertebral subluxation with the use of a chiropractic adjustment to restore neurological function and movement patterns. Okay, and chiropractors are the only ones who are truly trained to do that. There are other professions that may manipulate or mobilize, but they don't get the specificity that a chiropractic adjustment does, or stimulate the neurology the way a chiropractor does. So let's talk a little bit about that. What's a vertebral subluxation? Well, traditionally, you could look at it more like a mechanical lesion. It's a group of vertebrae or one vertebrae that, for whatever reason, loses their alignment. So they lose alignment. They're not moving as well as they should. They get fixated, weight bearing changes. It affects the local neurology, whether it's the joint neurology or the nerve root that exits between the vertebrae. And there's different components to that. When that happens, which is usually due to some sort of stress, whether it's a physical stress, emotional stress, or like a nutritional chemical stress that can move these things out and get them fixated, they will interfere with the function of the nervous system and potentially the nerve roots that come out between the vertebrae and go to the different tissues and organs of the body. And an adjustment is when we correct that. And there's different ways to correct the subluxation. First off, chiropractic analysis. Chiropractor is trained to check for subluxation, and there's five different components of that. First, the disc can start to degenerate if the weight bearing is altered and the vertebrae are fixated. The disc, the intervertebral disc, might start to degenerate. That's the first thing that happens, aside from neurological dysfunction. Two, it increases load bearing on the soft tissues like the ligaments and the muscles. So you get some changes. You get some adhesions, or maybe some scar tissue, which is going to further reduce the movement of the joint and make it more susceptible to things like pain. The last thing that changes is the bone. You start to see bony changes. That's when it's been stuck for a really long time and the weight bearing has been altered, and you get bony changes. And chiropractors are trained to analyze for subluxation. We do that through different means. We can look at x-rays, motion patterns, evaluating muscle tone, things like that, but also like length discrepancies and challenges. Muscle testing, like applied kinesiology, is a great way to do it. There's all different ways to challenge the body to determine not only where the misalignment is, but if it has a neurological component. Like looking at the muscle tone, things like that is also really good. So none of these activities I talked about, like I said, they complement chiropractic care very well, but it's not a replacement for the chiropractic adjustment. That's very specific. And we're really the only people who are trained to do that, or as good as we do it. So then, what about self-adjusting? That's another thing. I have a lot of patients who come in and say they've been self-adjusting themselves. Well, just today, it's somebody telling me that the way he lays on his back and rotates himself and gets a pop, or a crack in his lower back, but he really needs me because he can't do it to his neck. So, he sees the importance of the chiropractic adjustment to have his neck adjusted, but, it's helpful with his lower back, but he feels he could do that himself. Or even something like a chirp wheel. I mentioned this earlier. I actually really do like these devices. It's a great mobilization tool, but it does not replace the need for a chiropractic adjustment. Or even if you're trying to self-adjust, you may mobilize the joints, but you're not correcting the subluxation. A chiropractic adjustment is not necessarily the force that we use. It's very quick and very specific, right? So that will improve the movement of the vertebrae and the alignment. It's not necessarily as much about alignment. Yeah, we're getting things to sit in there better, but it's more about restoring movement patterns and stimulating the nervous system that way. And a tool like this, yeah, you're gonna get some pops. It's gonna mobilize the mid back, maybe a little bit of the low back, but it's not doing that quick thrust to stimulate the neurology. So it may make you feel better, but it's not really doing a lot of correction. Same thing with the foam roller, or if you're trying to self-adjust. And when you are self-adjusting, if you get some pops, typically what you're doing is there may be some subluxation, right? Vertebrae that is stuck and not moving properly, and other vertebrae start to move. They pick up the slack because the body wants to have proper movement. So it's going to have other vertebrae that maybe move a little bit more. So and they can get sore because they're carrying a little bit more of the load. So when you're self-adjusting yourself or self-cracking yourself, typically what you're doing is getting more movement into those joints that may be moving a little bit too much to begin with. And what the chiropractor does, we find the restricted joints, apply a specific motion into those joints, correcting their movement patterns, and everything else is going to kind of fall into place and get normal movement patterns. So, people who say that they're self-cracking or self-adjusting, they're really not. I can't even adjust myself in that way. They're just kind of increasing movement into joints that may be a little bit hypermobile to begin with. So really, they may be worsening their problem. So anyway, so I think this is a really important topic. It comes up a lot in the office. Like I said, these things, whether you're exercising with a personal trainer, massage therapy, yoga, Pilates, barre classes, even physical therapy, acupuncture. These are all great things. They complement chiropractic beautifully. Like I said, maybe you need a little bit less chiropractic, but does not replace the chiropractic adjustment. So anyway, I hope this clarifies that topic. If you know anybody who could benefit from chiropractic care, have them give us a call. If you're not in the area, then refer them to another chiropractor somewhere else, because chiropractic care is so important. So again, thank you so much for watching these videos, and I'll be back next week with a different topic. As always, if you have any questions, just instant message me, and we'll see you soon. Thank you.